That's all. Thank you, Carrera. Good job, everybody. You're so well done. I took the liberty of sharing Colitis Canada website to you because I know that some of you may be extra interested. As well, YouTube on inflammatory bowel disease, which covers this stuff from our Crohn's and Colitis Canada. So definitely some really good information in there. Again, remember the good information that's outside of Mosby's textbook, of course, right? Those questions are going to come, but for that critical thinking, for your understanding, for understanding about like this person's journey, for right the empathy, that kind of stuff, like always can go to these types of websites, CMHA and all that kind of stuff. I will. Did I tell you about the gentleman that I took care of with Crohn's, his first bowel resection surgery? I was a baby nurse. I was still a nursing student,
thank you, sir.
At this point, and so I only had one client in the hospital, and I think it was two. I had a mom nurse overseeing what I'm doing, right? Just like we're going to go to clinical, somebody's overseeing. So I came in, and my client was a young man in his early 20s, and he had just had his first bowel resection, so surgery to remove part of his bowel
Salamat, sir.
for his Crohn's, and his prognosis, what they were expecting, was that this gentleman was probably going to end up having one of those colostomy bags. Remember, elimination section, colostomy bag, but he didn't have that yet. So right now they just removed a piece of his colon surgically, really disease prone, so mecca, right? And this young adult was a little bit difficult because I was pretty much the same age as him. I was like maybe just a few years older. And he was very hyper-focused on the fact that he was never going to get a wife, never going to get a girlfriend, never going to have children, he's never going to get married, because who wants to be with someone who poops in a bag? That's his exact words to me. Who wants to marry someone who shits in a bag? That's what he said to me. Literally. I was like, whoa, right? Like, we need social work here. This guy's got to talk to somebody. He needs some talk therapy, big time. We need some learning, right? So, anyways, my documented and all that kind of stuff. But I was so lucky, I got to take out staples for the first time as a nurse on this client. His staples had to come out of his abdomen, his low abdomen, from his resection. And so I remember going to him, and he knew I was a baby nurse because, of course, I introduced myself as a student nurse and the like. And Elvia, and now it's time for to bring the whatever. I don't know how well it went down. And you got to take the staples out of your abdomen. And are you okay? I'm going to do that. Are you okay with that? Yeah, that's fine. No problem. And I got everything ready. Everything was good to go. Then I went and washed my hands again, and I was ready to go. And then I said to him, would you mind pulling your pant down just a little bit for me? He did not need to expose his peri area at all. I just needed the pajama pant had to come down a bit so I could take the dressing, the bandage off. Okay? He wasn't exposing his penis or anything like that. But I actually asked him, can you pull your pant down just a little bit so I can access the whole thing? This guy looked at me and he said, you're the first person to ask to pull my pants down. I went, wait, what? I shouldn't be the first person post-surgery. How many people have been pulling your pants down? And I'm the first one who asked? I was going to do it anyways, right? I've taken the staples out. But I just asked him, can you do it? And he literally stopped me. He said, you're the first person to ask. I was just like, it was one of those reminders in my head. It's like, oh my gosh, it's something so small, but it obviously meant so much for him that he stopped me to thank me for asking to move his pant. I wasn't even exposing him. Oh, right? Like, nothing got it. It was just one, but like, could you just do that for me? Thanks, Tracy, right? He was not feeling dignified, I think. he was feeling like, where's my banana, right? Like when the dog just rips the thing around, right? Like just being manhandled by staff, and he's just letting it happen because he's nice, or it's a nurse's job, and it's their job, whatever. But obviously, right, that comment to me is making me feel like he hasn't felt like a human. And the fact that he's saying these kind of body image issues, like he's saying these body image things to me too, and he's telling me nobody, was talking to him about pulling his pants down. I feel like, oh, this poor guy's brain, eh? He just must be really suffering with body image and changes, and his life is changing, and he is getting surgery, the condition, and everything, and it just must be a real struggle for him to put a smile on his face. So just that little side piece, right? Just because they look like you or I standing there doesn't mean that they're not suffering silently inside their head with those things. So please do have compassion and empathy for people who are having bowel and elimination GI issues, because it's embarrassing, right? One of my friends, she has Crohn's, and we will be at the farmer's market, and she'll just be complaining about her stomach, and she's like, can you see my bag? Is it sticking out? Like, she's consumed about it, right? So that changes her experience of, she can't enjoy the market because she's thinking about her bag and those kind of things. So really do have that compassion and empathy, okay? Also, thinking about, they brought up a really good, right? Like those nutrition issues. If I don't have absorption, what's happening to my body, right? If I can't absorb the nutrients, you can drink as much Boost, you can eat as much, vegetables, you can eat as much pills, vitamins. If you cannot absorb it, you're not going to get the nutrition that you need. That's it. What do we know about? What are the results of poor chronic undernutrition? We know what the body does, right? So you see how I can like layer some of these issues now, right? See that nutritional intake. Diverticulitis, diverticulosis. Did I assign that one? No? No? Good. Okay, so have like many people, their colon, their intestine tract, has little pouches that exist, like little pockets, little tiny pockets, okay? Oh, got some pockets. The pocket is named a diverticulum, singular. Diverticulum, okay? The condition of having these pouches is called diverticulosis. So you have one pouch is a diverticulum, you have more diverticuli, right? Lots of pouches. The condition is losis, diverticulosis. If the pouches are angry and inflamed, diverticulitis, itis. The osis is a condition. When they get angry and inflamed, it becomes itis. Diverticulosis is my condition. Now it's diverticulitis because they're angry. Okay? That losis, lysis makes people angry for the rest of their lives. Is it losis? Is it lysis? What's going on? You've got diverticulosis. If you're in a flare-up, if you're in an angry episode, it's diverticulitis right now. The itis means what? Inflammation. So if you're not having angry pouches, then it's just the losis. It's the disease that you've got. That's the thing that's going on. Okay? Little crayon explanation there. No permanent marker, but that's it. That's where you're going. Okay, losis is the condition. When it's diverticulitis, you're in an episode. Okay? Beautiful. Got these pouches. Oh, you're so angry. Okay. We want to, people who have a low fiber diet might be at risk for it, right? Because what do we know about fiber? It's getting rid of stuff. So if I have low fiber, is there a chance that stuff is staying in there? We might not be removing all of what we need to, maybe. Chronic constipation, like stuff sitting there, right? These people often have the pain and tenderness, the lower left. Ooh, guys, remember, Quadrants, there's 4 quadrants. Going back to, this will be what, foundations? I don't even know which section. Oh, that's true. Left lower quadrant is that spot for the mega pain. That's where that pain's really going to be. Okay, or often, I know not everyone fits into the perfect boxes, but Mosby's is telling us, right, that the diverticulitis pain is going to be that lower left quadrant pain, right? Fever, nausea, chills, right? Those signs of infection, fecal matter, inflamed pouches, and the glosis turned into itis. Itis, right? Itis inflammation. You may see bloating, you might see some rectal bleeding, right? So you might see some blood with the stool, okay? Might have some pain happening. It makes sense. If I've got inflamed pouches, well, it makes sense, right? I can put these kind of things together, right? It's not supposed to be big and angry. Because big and angry probably hurts. Things shouldn't be big and angry. It's logical to think when things get inflamed and angry, they hurt somehow. Keeping that in mind, these people might have upset stomachs, painful abdomens, right? This kind of thing. You may have a pouch that causes an obstruction or a blockage in the system. Oh, a blockage, you say? What do you mean a blockage? Literally a blockage, right? We've got an inflamed, angry pouch that's full of fecal matter and it's all angry and it's sweat pressing on. What do I know about this intestine? It's all going like this, right? It's kind of all mixed up in there. So what happens if I get a pouch that's big and inflamed? Could it be putting pressure or compressing part of that intestine? So in our diverticular disease, we might have bowel obstruction as a complication in that pressure. Okay. These clients are often going to have dietary changes prescribed like immediately by the physician. They're going to change the diet, right? Working with dietary, the doc and the dietitian and the team, right? Making sure that we're getting the nutrition that we need, but in a way that doesn't exacerbate the condition. Sometimes these clients might get some antibiotics, right? Because this infection brewing, right? Sometimes people might be candidates for surgical interventions. Okay, so we might need surgery. And sometimes people might end up with a colostomy. So ultimately, if that disease is too bad in the intestine, we can divert that waste out the front, out the abdominal wall, right? If it's that bad, no matter what the thing is, we can divert it out the stomach, right? We get that stoma, and then we can eliminate into a bag or whatever it is. Okay? Cool. Let's end there. Let's have an hour of independent study instead of 15 minutes. Rather than me jump into communicable diseases, we didn't take a break. So we'll end here and we'll restart at 1 p.m. for attendance. So you can use the next hour for reading for your workbook. We are going to take up some workbook questions this afternoon. So the after lunch part will be to rip through communicable diseases real quick. And hepatitis went with this one, so I don't even have that on my list for the afternoon. And then we'll take up workbook in the afternoon. Okay? Awesome! Work ahead, go ahead, check the syllabus for the next chapter. If you want to be move a day ahead, that's all fine. We do have a thing due on Friday, so you can work on that as well. Okay? We'll see you at 1 for attendance, okay? I'm here anyways, but for attendance. All right? Please do get some good studying done.
Addison.
Yeah, Charmaine. Yes, Adriana. Just the single one on the Friday, and then test next Tuesday.
The oxygen therapy is the only one.
Yeah, oxygen therapy is the only assignment for this module, due on Friday. I just don't know when yet, but due on Friday. Drop-off's open Thursday.
Okay, thank you.
All right? Yes, independent. Should be having one from everybody.
Sorry, Allison, I was asking about the upcoming modules, like the abuse and the medication, because I know that they're really close together.
Yeah.
Just for planning purposes, I'm curious if you know if the assignments are independent or if they're going to be group assignments.
I'm not. I think that they're independent. I'm not sure. But the abuse assignment's going to be done completely in class, and the other two you have the whole weekend to do. The medication assignments and tests are going to be the following Monday, as per my little thing that I gave you guys yesterday.
Yeah, no, yeah, I see the schedule. The schedule's great. I'm just trying to plan because I also work. So if they're going to be like group assignments, then and not just planning wise.
Okay, well, the abuse assignment is done in class. So there's nothing outside of class time for the abuse assignment.
Okay.
So that's the first one that I can for sure. I'm not 100% sure about the ones that are for over the weekend, but the abuse assignment for during the week is in class time.
Okay. All right. Great. Thanks.
One step. One step.
Yeah, because when we have like back-to-back assignments and tests, I need to plan in advance, or else I won't have any
Okay,
time.
hold on right now. I'll look forward. Give me a minute. I have to look for the medications. Let's.
Maraming salamat, Sir Grits Figueroa, Million Ways. Thank you.
And they probably won't be open for us until later, right?
Because I don't actually run the break space, I'm assuming that they're gonna open this week for us. I'm assuming. At least the first one, because it starts on Tuesday next week. So I don't know how if they open a week in advance or whatever. Like it's all plugged in on by the LMS people.
Oh, okay.
I don't have any. Okay, let me see. That's gonna be. I think that's in class. And there's a component that's in class that's group, and there's a take home that's individual for medications. So you have no group work that needs to be done outside of class time. So if you're in class next for those two modules, if you're in class, you'll have all the time you need to get your group work done.
Okay. Okay, that's good to know.
The weekend assignment will be individual, so you can do it on your own time.
Okay. Perfect.
Yeah.
Right.
Okay. Ciao, ciao.
Lumayas ang ano, lumayas ang host ninyo guys. Particle, Sir Particle, good afternoon. Thank you for coming. Gaganda 21, Triple J, Mix Vlog, thank you for being here. Pumunta lang ng palengke ang host. Kaya nawala sandali. Thank you for coming. Okay. Here we are. I'm back. Hi. Hoy, nakaw, nakahom na ka panood to. Abdi ka, oy.
looking at the reading, the oxygen therapy reading.
Yes.
I don't know if my reading comprehension is not there, so I'm spread.
I can appreciate the thought process there, right? I did the same thing. I'm like, am I just like missing something here? I'm not sure.
Yeah, I'm not getting some of the things. I mean, is this the only thing that we have for the assignment to work with, or?
What do you mean?
This is the only material that we have for the assignment, or we can, or there was something else issued.
Like the assignment reading? You mean like
the oxygen therapy, the oxygen therapy.
I would start by using that, as well as like maybe there might be information in the respiratory sections like that might help with that information. But I think that's the starting point. Should be that oxygen therapy reading should at least be the starting point for you.
I'll try to read again.
Peak here. So yeah, you can use Mosby's. The materials required will be the passage for oxygen therapy and your Mosby's textbook. So Mosby's and the that assignment reading piece should be enough to get you through. Okay.
Yeah.
Absolutely. Yeah, this one might be forcing us to use our brains a little bit more. That might be where you're thinking you want the answer to be on the page, but they might want you to use your brain to get the answer, right?
They might want me to read.
I love it.
And I'm just scanning through.
Okay, let me jump here. There's still issues happening, of course, with this attendance software, so I'll pick you all up here on my paper copy to do later. Welcome back from the lunchtime. I heard something. Adriana, Asmara.
Belen is back.
Hello. Sinette, Caitlin. Yep. Caitlin's got it. There's also a chunk in here on oxygen. Charles, Caitlin, Charles. Get distracted. I have to not read the comments. Just look at the people's names. Kalia, Myrna. Can I go? Kalia, Myrna. No, Myrna. Victoria. Abe. Belen, I got. Victoria. Caitlin, I got. Australia. Me, Victoria, Nestor, Carrera, yes, okay, I got Charmaine, I got Sinette, got Danielle, got Davidson, got Elvia. Jason, do we have you back? Whoa, Siobhan, I love that mask. Stellar! She looks so good! Fancy, I'll take it. Yep. We've got... Thanks, Veronica. Okay. All right. Got where we go. Just Jason and Tracy. That's it. I'm sure they'll be here any moment here this morning, so expect them back. Okie dokie. So, plan for the afternoon. We'll do a little bit of chit chat surrounding the communicable diseases in Mosby's And then I will do a little bit of workbook, take up for us, and Pastor and I don't even know how to use the real mask now. The metal part goes across your nose, Pastor, so you can pinch it. Okay. Oh, funny. I got some cute nursing fabric that I want to make some fresh masks for the fall with. I've got some cute fabrics. Yeah, super cute ones. You know that the heartbeat that comes on the monitor that shows the heartbeat. I got a fabric that has that on it. Yeah, little cute ones like that that are like little healthcare related. Adorable. Most of mine are plant related material. Plant fabric, leaves and things like that. Yeah, totally. That's my style. Okie dokie. So yeah, so a little bit of lecture and then a little bit of workbook. We'll just, I don't know, we'll get a little bit done. And then I'll let you guys have that time to work on reading the oxygen content and starting to work on the assignment there. Looking ahead. Chapter 41 is the oxygen chapter. It comes up as the homework on day 4 homework or day 5 homework. It gets assigned to us as homework maybe like Wednesday. Things due on Friday. So there is, in fact, additional information over and above the respiratory sections that we've been covering and like those kind of things. So you might want to review the health conditions that are associated. You might want to review the anatomy and physiology, like kind of the normal, to help with that understanding about what's happening. You all know, if you need more or less reading to go along with it, but those will be the places to peep. But you do have the oxygen therapy reading provided to you in the bright space. I have no idea, David said. I have no idea. I do not know the answer to that question. I would definitely, of course, please email trios, whoever wanted to know your statuses of things, whoever you were sending information to, maybe, I don't know, they might be the ones who can let you know if it's mandatory prior. I can't say it's COVID because I don't know. Usually it's not, but I don't know if it is or isn't. So do check yourselves, okay? I'm not sure about that. Okay. Hopefully they'll let you know. But I'm just saying, since it's on the tip of his tongue, on his brain right now, he's thinking about it, shoot the email off. Worst thing you're gonna get is no response. Second worst, they'll say I don't know. Third worst, they're gonna say yes and it was due last week. But Davidson, be careful with you're getting if it's an employer who is giving you a job versus are you required to have it for placement? I don't know. Double check with the school because the school is liaisoning the requirements, right, that are required at the placement places with the school, with the students, and all that kind of stuff. So just, I definitely suggest following up with the school for that yes or no, or no idea, or just to be ignored. But at least send it. At least send it to the school. Okay. But often they might ask for it after you hire, and they give you a little bit of time. But like I said, I don't know. Every employer is different, right? How their onboarding stuff happens and flows. So just double check, like I said, with the school first, because they'll have the parameters that the facilities are requiring of you, right? So if they like Travis calls me and they're like, Allison, what do the students need to come and work for you? I'll be like, I want them to have this, and this is mandatory minimum requirements. And the school will come back and say to you, you need these things or you can't go, right? So, like I said, just I would double check with the school, okay? Okay. This, no that. Full painful. Doesn't really hurt to get your fit mask done. Had a million. It smells bad if you fail your mask fit, but doesn't hurt. It's annoying. I keep forgetting there's 7 days of this. Oh my gosh. I'll give you time this afternoon to do some reading. Where am I? Okay, that wasn't the answer I was expecting, but yes, I will agree. Very painful. Yeah, if you don't want to shave your beard, don't go into healthcare. Don't go into mining. You need to be able to have that tight respirator fit, firefighting as well. You have to be able to have that fit. We had quite a few laughs with our surgical team when they have to give themselves a nice clean shave. We often joke we don't recognize some of them without their beards. But yeah, no, in order to get that mask seal, you can't have the facial hair. So yeah, any person who is proud of their facial growth would find that very frustrating, without a doubt, to have to go through that fit mask. However, when faced with something that can go through droplet masks or the like, we need that N95, or we need a full respirator, or we need a full hazmat suit, right? But the inside the big suit for radiation poison, right? It doesn't matter, right equipment for the right purpose. If you're exposing yourself to something like that, you do want to have the most appropriate, the best seal possible to keep you safe. That's the goal, anyways. Okay, where am I? Come back, Allison. Where are my notes here? Rejected a new job because of this recently. People do. People will absolutely. We have to have it for our airborne precautions. I lost all my notes. Everything closed. Okay, where are you? Sorry, everyone. There I am. Notes on day 3. Gastrointestinal. Alright, what else was there in GI? We didn't really talk about it because we talked a little bit about it before, but your clients in care might be getting enemas or suppositories if they haven't been having a bowel movement or something like that. So we might be giving them medication to encourage that bowel movement to happen. So I might be thinking about that as the client or as the PSW, that my client might need more pericare. Today I might be anticipating that they're going to have some diarrhea later. You know what I mean? So I can kind of have that in my mind, prepare myself. We mentioned perchance the need for a colostomy bag if we are surgically removing some of that intestinal tract, right? As an intervention, surgical intervention, if it's not serving us well, right? If it's needs to be removed, we can do so. And if we take a lot of the intestine away, then we can divert that out using a stoma, right? And attach a little bag, and we can catch it and dispose of it that way. Hey, Trace, thanks. We talked a little bit. Oh yeah, we had mentioned stool specimens beforehand when that came up in the infection control area and specimen collections. The stool specimen came in there. Whenever we're taking any specimens, we want to avoid cross contamination if at all possible. I would try to take things, use a clean, a brand new popsicle dipper, like open up the tongue depressor and you can get a fresh piece. Take it from the middle, not the part that's touching brief or touching the side of the little hat in the toilet or something like that, right? You want to reduce any chances of anything else getting into that sample when we send it away. So no matter what the sample is, right? I want to try to avoid other bugs from being in there. We don't want to give people medication that they don't need or contaminate the sample and we have to get another sample. And frustrating and take a long time. So it's kind of just, it falls under the work smart part, right? We did talk about GERD, acid reflux. Yeah, we talked about those concepts. We're good there, I think. All right. For communicable diseases, we started that hepatitis talk with the liver in GI. So also falls under the communicable part. So the hepatitis presentation falls under there as well. And then we may have some others like chicken pox, for example, childhood, right? Disease of chicken pox, and we have immunization now for chicken pox, but we had talked about this before. Back, when I was young, we had the chicken pox parties. If one kid in the class got chicken pox, it was like play date central. Send everybody and your kid, your and the siblings and everybody, where it was like get the whole house infected with chicken pox, and then it was done. We wouldn't have to deal with it again, right? There's a few others that we have immunizations for now. The Tracy had mentioned the MMR, measles, mumps, rubella vaccine we have. So that one's for measles, mumps, and rubella. Okay. We've got, what are some other common childhood ones? Whooping cough. Lots of you have heard about that. Whoop thing.
Woof, woof.
Ha! Whoop thing. Right? Foot and mouth?
No. Yeah.
What about it?
My son had it. That involved, is that included in this, what we're discussing?
Yeah.
Or does that go under skin?
No, it's a viral infection.
It was bad. My grandkids had it. It was really bad.
Yeah. Well, it's a viral infection, and what did we learn in infection? She gave herself worms because she chews her fingernails, right? So you can imagine how easy it is to get a virus inside of your body, right? We're all of you, right? Everyone's avoiding potlucks like they're the plague. Oh, that's a funny one now, eh? Avoid it like the plague. That little, yeah, right? I'm going to avoid potlucks like the plague. Yeah, so I don't catch the plague at the potluck from Allie, who doesn't clean her. Right? Bad infection control in her kitchen. Right? Contamination. Right? Chickenpox part. Yeah, exactly. The wild virus. Exactly. Here is some information for those. There you go, Linda. There's foot and mouth. But it's just a viral, right? And when we see things are really common with the kids, right? Because they're touching everything. They're not washed. They're not doing hand hygiene like we are as adults, right? So it's really easy to pick things up and transmit them, right? So from infection control, we know things might be contact. Some things might be droplet. Some things might be completely airborne, right? So we have to think about those kind of things when we're talking about communicable diseases. Right, and when we did the hepatitis one, we saw, right, some is like fecal matter, but then you're getting it in an ice cube, so it's ingesting. Communicable diseases is in chapter 37. I'm still in chapter 37. I don't know, I'm not on a page right now. I'm looking at my notes here. Starts on 878. Communicable diseases starts on 878. Okay. There's Linda's extra for those of you interested in Linda's little note there as well. Oh no, where's mine?
Hello? Come back. I can't see anyone. Close that one, open this one. Ooh. Okay. Back on track here. Promise. Okay. Okie dokie dokie. So, so childhood, different childhood diseases. We have a nice vaccine. Actually, I should pull that up. Ontario vaccination schedule. Yeah, pacifier dropped. You didn't realize. Yeah, super common because it's so easy to pick it up, and that's exactly it. How many of you have literally been like somewhere, I don't know, Canada's Wonderland, down at the docks, I don't know, like walking the waterfront, exploring Toronto, and you literally turn around and you see some kid is licking the handrail and an outdoor metal handrail, like randomly, like, or like licking a window at the mall. Like literally, no, seriously. No one, like I've seen kids randomly lick. I remember I got dared by my friends to lick the sidewalk. I did that as a kid. I licked the ground outside because I was dared by my friends, right? Like, thank goodness I didn't get foot and mouth on it or whatever. But like, you know what I mean? Like, kids do dumb stuff. And toddlers, right? We did those developmental stages. They're learning. They're exploring boundaries. You know, all those kind of things. Yeah. Now when Tracy sees kids lick things, she's having like, her brain is actually like exploding in her head, like, oh, don't like that. The whole point of all of that teaching, it wasn't to turn us into hypochondriacs, wasn't to like, you know, scare us of going outside or that stuff, right? We have these strong immune systems that work to protect us, and right, for the most part, we're okay. But yeah, now that you know, you can't unlearn what you know now about infection control. So act accordingly. This one, this is a good one. Here we go. For those of you just interested in the vaccine program, it tells you which vaccines they're giving, and it explains a little bit what they all are. Okay, so you can just, and it's just like 2 sentences. What's diphtheria? What is tetanus? What's pertussis? They should put cartoon images of microbes everywhere for them, right? Well, and we know that with the developmental stages and stuff too, though, there's like, we can like start to teach them about, right? You can mimicry first. We always get into habit, have them just copy hand washing until they can understand hand washing, right? And we can give a little bit more information as they develop and grow and can buy into this, you know, why we should be doing it. Okay. Other communicable diseases, though, that we, besides the hepatitis that our chums, our classmates so beautifully presented to us, we may have influenza. Yeah, Siobhan, good for them, right? But like, to a degree, right? So that's part of when we have that discussion, right? You Lysol, don't clean your house like sterilized with Lysol. That's also not healthy, right? But we also don't need to live in raw chicken. There's a happy medium to be had here, right? With exposures to things. Play with your friends, but have a nice, we're going to have good nutrition and things to support healthy immune systems and stuff too, right? And then you have hand washing and like, exactly, right? We need that exposure to build our immune systems as well, but there's definitely a happy medium. So I wanted to mention as well, the flu. The seasonal flu.
That's us.
I assigned it to somebody. Okay, wait. What else do I have? Then I have HIV, STDs, and the flu, and tuberculosis. Those are my last four. Do you want to go? You guys can do first if you want.
Jason, please.
Jason's like some of our others. Has got some internet issues with the connection happening here, so give him a minute to come in and upload himself into this into the camera piece here. I know it's been a struggle for him.
I think Jason with Tracy in this space.
Yeah, absolutely. Back and forth, right? You know what I'll do? I'll give it, Jason, we're gonna give you a second to get in here. I'll talk about the next one and then we'll come back to influenza. Just so that I bet you he's on his side going like connect, right? You're here. I was just gonna give you guys an extra second though to get yourself sorted into the thing. If you're ready to go, you can have it now, or I'll do the next one. It's up to you. I just figure you're probably having a panic behind your screen trying to get in.
Okay, I can go. Sorry. Yes, sorry about that. Just 1 second, let me get. I'm so sorry, man. Here we go. Sorry to have everyone waiting. My humblest apologies. Influenza. Okay, ready, everyone, miss?
Go for it, Nastran and Jason.
Okay. Our group assignment was between Nastran and Jason. It was based on influenza. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it's not the same as stomach flu virus, which causes diarrhea and vomiting. For most people, the flu resolves on its own. And we're oftentimes wondering what causes flu. Basically, the flu is caused by the viruses that infect the nose, throat, and lungs. These viruses spread when people with flu cough, sneeze, or talk. Also sending droplets with the virus into the air and potentially into the mouths or nose of people who are hereby. So those are a few ways in which influenza can be transmitted. What's important or critical to note is that there are 4 types of influenza viruses: A, B, C, and D. Human influenza, which is A, and the B viruses, which is called A and B viruses, causes seasonal epidemic of disease, which is known as the flu season, almost every year in Canada or the United States. Now, there are 3 different types of flu, and these 3 different types of flu, as I would have mentioned, A, B, and C type, they all cause annually flu epidemics that have up to 20% of the population sniffing, aching, and coughing. Those are just the flu. How long does it take to recover from influenza? Sometimes it should go away about 5 days, but may still have a cough in a few weeks or a day longer. But hopefully all your symptoms should be gone within 1 to 2 weeks. Is there a difference between influenza and the flu? Influenza is a viral infection that attacks your respiratory system, your nose, as I would have mentioned. And of course, the flu is slightly different because people with flu are most contagious in the first 3 to 4 days after their illnesses begin. Most healthy adults may be able to infect others beginning 1 day before the symptoms and develop up to 5 to 7 days after becoming sick. Now, these are some critical things that a personal support worker can do to support someone while having the flu. They can maintain proper hygiene and good health habits, which are all important to preventing the spread of the flu virus. For professionals such as personal support worker, we can include the trainings by washing our hands regularly with antibacterial soap and warm water. Just a little rinse isn't enough. Hands should always be scrubbed at least according to those protocols that is designed for how long or the second for you to wash your hands, maybe 15 to 20 seconds. And the reason for that is to ensure all germs are eliminated. Also, when we can make sure that the countertops, the doorknobs, and handrails are totally sanitized or germ-free. And of course, this will minimize the chances of germs surviving on these surfaces. Also, I can encourage my clients to avoid touching their nose, mouth, and nose, or touching any of those areas that can spread germs to the respiratory system. Nastaran?
Yes, thank you. So the risk groups for influenza-related complications are pregnant people, children, and adults with the following chronic health condition: cardiac and pulmonary disorders, diabetes, and other metabolic disease, cancer, and other immunocompromising condition due to underlying disease and therapy, renal disease, anemia, or hemoglobinopathy, neurological condition, morbid obesity, resident of nursing home and other chronic care facility, adults 65 years of age and older, all children younger than 60 months of age, people who have reduced access to health care, such as vulnerable population like those experiencing homelessness or those with disabilities, people who are at an increased risk of illness because of living conditions, such as those who living in shelter, experiencing overcrowding, and who have limited access to facilities for personal hygiene, or people, person with disabilities who might have limited capacity to understand or perform personal hygiene practices. So prevention and control, you can control this disease easily by annual influenza vaccination. So it's the most effective way to help prevent influenza and the complication after that. And then you separate the person, utensils and glasses, and change the bed sheets and pillowcases every day, or if they get soiled, then let the person to wash their hand every frequently and before and after eating. Wash the sink and washroom daily. Wash their laundry with hot soapy water according actually to label and cloth, and use gloves each time you are contact with their secretion or excretion. And the treatment would be some people they will get mildly and then they don't need medical, but some they can have antiviral medication. And as I said, the vaccine is better than taking medication. And the common things that you do for your when you get sick is staying home and get plenty of rest, drink plenty of fluid. Actually, it should be according to the care plan. Sometimes some patients they can have lots of drink, and treat cough and aches they have. Then have some juices like orange juices helps because they have vitamin C and folic acid that helps with your immune system, it boosts your immune system and helps to get over the disease. Thank you.
Very nicely done. Another wonderful presentation. Thank you so much. A few wonderful points. I just wanted to remind everyone when Jason was telling us about hand washing, right? Infection control section, sing yourself happy birthday. Remember, When I did my courtesy wash, he added that in there. Just a simple rinse is not good enough. You actually have to do good hand washing to rid all that stuff from our hands, and we need to actually scrub in all of these areas. Lots of hidden stuff, right? That the MythBusters guys, that infection control stuff, right? As well, thank you so much for reminding us about the social determinants of health and the risk to my clients who are marginalized, these marginalized populations, people living in shelters, people living in long-term care facilities, right? We have a lot of people living in close quarters sharing things. So the risk is much higher. The risk is much higher. And that flu shot, right? That prevention is key. Right? I get that shot every year. Every year since my brother had cancer as a child, I've gotten the flu shot every year. Every winter I go and I get it. Despite needing it for work or anything like that, I just go and get it. It's become my habit. I get it every year. Can I still get the flu? Yep. Can I still get sick? Yep. Am I less likely to have complications to my flu that will land me in the hospital? 100%. So I'm more likely to just recover at home in a few days? Yep. So that's why, right? I want to reduce that risk. I don't want to be running around spreading anything. And I also don't want to have a really bad time at home. I don't want to have to go to the hospital for it. I just want my body to clear it. But when Nastran was reminding us about those high-risk people, you know, why is someone with diabetes? Why are there people with respiratory disorders? People who are chronically malnourished, people who have no immune system, right? They can't fight it. They're not going to be able to do as good a job fighting as you or I. So by me getting it, reducing my chance of getting and spreading, and you're getting it, reducing your chance of having a bad episode with it, right? So that's not, our vaccine programs don't necessarily say you're never going to get something, but have we reduced the risk of you having bad complications? Have we reduced the risk of like these kind of things? Yeah. So that's that win. That's winning, right? We want to reduce the chance or the likelihood or the damage that could be done. Right? Reduce the damage, potential damage. Okay. We may get it, that pneumonia might develop. I had the right because maybe I aspirated some stuff and it went in my lungs, or the mucus got in it, and then it end up with an infection, right? If I don't have a good immune system and I don't eat, and you see how all of these risk factors, they just I keep adding them, keep throwing things into the fire is going to get really big. That risk level is really high for lots of different conditions because all of the problems that these people have, their disease processes, and then because of the disease, this is happening and that's affecting us over here, and then this is happening, it's affecting us here. It's just big pizza that we've been cooking all semester, right? Interrelated. But hopefully that helps a little bit with their explanation, a couple extra points that we add in. Okay, so that's really what we're doing there. We want to try to keep as many people having the least amount of bad experience as possible. We want to have a mild experience. If you're going to get sick, we want you just to be mildly sick, right? That's my same wish for people who get COVID. I would like you to be at home and recover. I don't want you to go to the hospital and be in the ICU and on a ventilator with a machine breathing for you. I don't want that for you. If you're going to get COVID, I would like you to have a nice, gentle time at home. Take a few days off work. Right? Right? I don't want people to go to the hospital. It's not nice.
I know.
Hey.
Yeah.
Sorry, just 1 second. Okay, the dog was dreaming. I thought he was having a seizure. He was on the floor going, he was chasing something in his dream. I just saw his leg though twitching out the side. I thought, oh my gosh, he's fallen or something. Okay. Anyways, he's fine. He's good. No, a nightmare averted. But that was my. You will learn when you go and you're working in your units. You're working with your clients that you know the noises. You know the noises that their bodies make, that the machines make, that these things make. Just like when I never want to make it all encompassing, but I know some people, if there's been a baby at home or you're babysitting or you're watching a baby, it's like you hear, that was a pin, this was the thing, this was that thing, this is that thing. That noise that's a different noise. Go check the baby. Right? You panic because you never heard that noise before. It was just the fan. But it's like, oh, I gotta check the baby. And the same thing. You become in tune with the noises of where you work and the clients that you work with. This is no different. So that's what happened with the dog just now. Yeah, he must have been chasing rabbits, something. Yeah, definitely thought that he was having a seizure. maybe the same thing, chasing rabbits.
Oo, si Joreds yan.
Okay, so the influenza piece, really, really well done. The more chronic diseases, the more chronic illnesses, that we stack up on top of people, their risk factors
Nagbago.
really increase, right? For negative outcomes. That's a nice way to put it. Negative outcomes. Most deaths from the flu happen in our elderly population, right? I'm good. Seasonal, largely seasonal. Yeah. Depending on whether you subscribe to the social media alarmists, I kind of laugh and say, why did we have less instances of regular flu this year? Probably because everyone was obsessed with hand washing and wearing masks, and we weren't having potlucks and coughing on each. Imagine, just rewind literally to the year before COVID and think about how people run around sick, or literally how we acted. And we're surprised that people get sick? Come on now. Now all of a sudden we're doing better hand hygiene. We're cleaning, people are going around cleaning doorknobs. Nobody cleaned doorknobs before. But people are now walking around their businesses cleaning doorknobs as they never did that before because they weren't a healthcare business, right? So they didn't think I need to wash my doorknobs or what, right? But now people are actually washing doorknobs. That's unheard of. Of course, we're going to see other things get decreased for sure, right? So just think about those habits. Our habits, how we act, right, can change these outcomes and stuff like that. So reducing the risk is really, really important. A little disclaimer here for the way that we fund the social side of healthcare here. This is why nursing unions, nurses, physicians, they seem to be pro sick days. We want people to get paid to stay home when they're sick. Why? Because I don't want you to come to work and make 40 other people sick with the flu. It's actually going to cost the business more money if 40 nurses, if 40 minors are going to get sick to just stay home. But then you say, well, I don't get paid to stay home. I need the money to pay my bills. I'm low income, so I have to go to work. See how what we want and what the situation, those social determinants of health don't always match the best practice, right? Stay home if you're sick. We realize that finances don't always allow that, so that's why we fight for sick days to be included so that you can get a minimum amount of money to stay home when you're sick so that you don't get other people sick, reduce the risk of transmission. But if you're just going to every farmer's market and putting snot on the railings, right? And you're just coughing all over everybody, we're gonna get people sick, right? That's the Mythbusters pat on the shoulder there. I love that one with the little leaking tube there, and he got transferred to everybody. It's so good though. That's real. Many of you wipe your nose and then just put your hands back on your steering wheel. Right? My husband works with cars. I told him, I'm like, you have to wear gloves when you touch people's steering wheels. They're like, that's fine, don't wear gloves when you touch steering wheels, but you better be hand sanitizing between. Looks at me, I'm like, the steering wheel. Do. Scratch my armpit, put my hand back. How often do you clean your steering wheel? How often have you coughed in your car in the direction of your steering wheel? Huh? Just saying. Just saying. But if we don't think about it, I'm just, right, that's part of that investigative healthcare brain that we're growing right now, right? Trying to think about it. Every day now before once a month, right? How many people are cleaning their cell phones? You take the cover off and clean. Do you open it up? Do you open your watch to clean? Oh, everyone's going like, oh my gosh. It's not to freak y'all out, but just start it in your habits, right? start having it happen. I just put a Lysol wipe in the car or whatever, so I can periodically give my handle, right? My steering wheel. Exactly. Just pop one on there, give her a wipe down, feel good, you know. When was the last time you cleaned your keys? Because you go digging in bins, you're at the Salvation Army, you're at the, what's the place that I go to get, you can get clothes there and stuff. Value Village, I go. That place is really dusty. I go to Value Village all the time. Super dusty though, it's not super clean. And they got like teenagers working there, low staff, all that kind of stuff. I'm not expecting it to be sterile. But, to Tracy, fine, wash your keys the other day. But in general, the population, we're in a PSW class now learning about infection control, but the general population, how many people, right? So they go, they use the door to get in and out. They're picking up things. Well, I picked up some of those hangers, put them back, right? Handled my money, all those kind of things, right? And then I grab my keys, I start my car, and then I clean my hands. Oops, should clean my hands before I pick my keys, or my keys were on the counter. So the cross-contamination is happening. So it's just about that frequency, being cognizant that I'm not clean. Don't put it in your mouth. Okay? You feel all itchy all over after put it in the wash right away, right? Elvia, disinfecting everything, clean everywhere. Good, Elvia, but don't rely too much on chemicals, right? We don't have to go too far, but it is important that we're being cognizant about it. Can I clean it? Was it a high-risk item? Is it an item that every person puts their hands on and puts back? Maybe I'll clean that one, right? Just to think. I feel bad now when I get judgy. I'll be like, don't pick it off the shelf and read it if you're gonna put it back. Like, look first through the window if you can see what you're looking for, then pick it up to read the thing. don't keep open and put it in, put it out, right? You know, it is what it is. Ultimately, we can pick things up from anywhere, but good habits, good infection control habits. Okay. Did I assign HIV to anybody? No, we're good. Okay, so I'm just gonna pull Mosby's. What do? They start with AIDS and then talk about HIV. Okay, so AIDS, AIDS. Some of you may be familiar with it. Some of you may not. There's a nice little chunk in Mosby's for you. Lots of cool stuff going on in this world. In research and treatment and all kinds of cool stuff that's beyond our level, but if you're interested, there is cool stuff going on right now, especially in Canada as well. But AIDS is the, why would they do this first? You get an HIV virus, and that progresses to AIDS. Okay, that's what's happening. Okay, so people will be coined HIV positive for a while before we say that they have AIDS, acquired immunodeficiency. Okay. Ultimately, you cannot fight infection. Okay, you can't fight infection well. Okay, so if we caught tuberculosis, if we got a pneumonia, right? So we become one of those high-risk people for bad complications. Okay. You, like I said, you might be infected with HIV, with the virus, and you may not have AIDS yet. Okay. You may not know that you've been infected with HIV. Okay. Oh my gosh, stop buzzing. The person who doesn't know that they are infected is a carrier still, though, and they can transmit it. Okay. The main ways that it's transmitted is unprotected sex, oral, vaginal, like any sex, because this has to do with your mucous membranes, like blood. Blood is getting transferred in this, like blood clots. So like stuff from inside the body has to get in, touch stuff inside your body. You gotta have an entrance way for it. Okay. And when we said unprotected sex, we mean not using a condom, like not using a barrier. Okay. So oral birth control, that doesn't count. Like you need an actual barrier. Okay. We might see it with needle sharing. So depending on population, right? Social determinants of health, access. Now somebody just went, oh, now I know why one of the reasons why we want to give people clean needles on the streets, to reduce the risk of bigger issues, right? We don't want people with an abscess or gangrene accessing the hospital. That costs money to help people, and they're hard to help because they don't have an address and all these things, right? So it's just a little bit about that, like social determinants as well, right? So we could see this with IV drug users, for instance, maybe passing from mom to babe. Okay. Breast milk, right? And those infected body fluids coming in contact with broken skin or breaking through the skin. So if Nastran is HIV positive or has AIDS, and I give her an injection, and then I hit myself with it, that's a transmittable occurrence. Okay, because it was a shared needle. I got poked with it. So as a healthcare worker, if I'm giving people needles, I need to be very careful that I don't poke myself when I give other people needles, right? I risk catching things, right? Yeah, Nasra?
Doesn't sound mosquito bite.
No, not mosquito bite. Not mosquito bite. That stuff has to go, it has to get inside you. Okay? Like, if I gave blood, and I've got a blood bag hanging here, and my HIV virus is in it, and then Nestor, you're in a car accident, and they give you my blood, you will get HIV. You'll be HIV positive because my blood was contaminated. Okay, that could happen for other reasons. There can be other bugs in the blood, but you know that's a direct me giving you what's inside me, but also the unprotected sex, right? These type of things. Or in healthcare, needle stick injuries, for example, where I poke myself by accident after I give someone else a needle. Right, that's a very dangerous. Daughter's doctor poked himself with, yeah, he was very thankful it was her and not another client. Yeah, if you get an injury like this, we have all, don't worry about it because it's not this, we don't have to worry about it here, but if you have a needle stick injury, we actually have protocols in place in our employment. Our employers have protocols in place of what we do should we get a needle stick injury. So, not to worry. They have plans. Don't worry. Stuff happens. You go for tests, blah, 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 blah. It's all fine. But we do. We have, right? Because it could happen. It has happened. It could happen again. Well, you saw the fancy needle that I had that has a special guard, right? So we have equipment that's special, and we'll do things in a special way. We'll, Safety is paramount. Yeah, now start again.
Sorry about that. So it should be, so it shouldn't be alive like a mosquito to transfer. But if, let's say, the cut cuts cause like something like a knife, the person gets knife, and that knife cut you, so the knife would transfer.
Transfer the blood. Yeah, 2 stabbings in one night. On the street corner. Give me your wallet. Yes.
But
There
not,
might be someone with HIV.
but if it goes to the mosquito body and then mosquito bite you, it doesn't transfer.
The mosquito's not putting that guy's blood inside you.
Okay guys, tapos na kami dito sa Sunflower Farm. Ito siya ang pinaka
Yeah. Is this a good one? Nature's not really the best resource. Okay, let me get a better one. Scientific American, I trust them. Here you go. Didn't even read it yet. Okay.
dito sa Sunflower Farm.
All right.
Ito siya ang
For later. For
Sunflower
later.
Farm.
Not for right now. For later. You can peek at that if you want. That's for Nastaran. Maybe not anyone else. I don't want to talk about the laws. I don't go into that. Okay. So these days, because we have all treatments, like things are really different now for people living with HIV and AIDS than it was in like the 80s, the 90s, the 2000s. Like literally right now, 2020, the world is different for these clients in first world countries, at least. Okay, in the first world. So at least here in North America. Let me even take that away. In North America, at least, quality of life and like their disease journey is totally different than it was in the 90s. Okay, we have so much more drugs and therapies and treatments, like just so many different things. People are living way better lives, less sick lives, and off the movies. No, not extra stuff. I know someone who's HIV positive, who's had a lived experience of street drug use and addiction and homelessness in Toronto, and here's a variety of places around Canada. He's HIV positive, but the medication that he's been on for the last like 5 years with his compliance, they can't find the virus right now. The viral load is so low in him. So it's like his quality of life is very, very good. He still is HIV positive there, but right now with his drugs, it's very interesting. So it's a really interesting world for these clients now in these days. Just it's gotten much more positive for them. So just so you know, it's not just, at least here in North America, it's not just a death sentence anymore in that sense. Doesn't mean that you want to have it, but it's we can do a lot more for these clients now. Okay. Typically, we're going to see weight loss, blood transfusion, Myrna, yeah. And that's right. This was an issue with Canadian Blood Services back at, what was this? This was like 90s stuff too, right? And contaminated blood, other things like that. I'm sure that you can find all of the old news articles and the stuff that like Canadian Blood Services went through and all that kind of stuff, and like lots of history with blood. Not Mosby's point here. No, you're like not the point for us, but yeah, absolutely. If you're nerdy into that kind of stuff, you can totally Google Canadian Blood Services and like the history of this stuff. Okay, we would see weight loss. We're gonna see pneumonias, night sweats, swollen glands, diarrhea. Okay, so like those common infection signs, but this is just a really systemic infection of their bodies. Okay, so you're going to see a lot of symptoms throughout the body. Okay, mucous membranes, right, and depending on the period of the infection, right, would change the symptoms that you're seeing, like always. Okay, ultimately, you know, with these kind of things, with any bloodborne diseases or anything like that, we're thinking communicable diseases. As a healthcare worker, I'm thinking PPE, right? So what PPE do I need? What's happening? Why do I need that PPE? So doing procedures, you know, make sure I have gloves on for pericare. I should wear gloves for oral care, right? Do I need full PPE? Like, are they sick with the flu and coughing and stuff too? So should I put extra PPE just in case, right? If someone bites their cheek and there's blood now in their saliva and they spit on me, there's blood in that saliva now, right? I don't know if they bit their cheek. I don't know if they have lesions in their mouth, so I don't know if what's in their mouth is contaminated. So I should keep that in mind, right? If Nestran so eloquently told us about our clients experiencing homelessness in shelters and the like, and their likelihood to catch influenza. So if that guy's going to get the flu really easily, and he's got this, right? What also do I know about that population? How's their oral care for the homeless population, right? What do I know about for oral care? What does that mean for my mouth, my teeth, my mucous membranes? So is this person high risk of having oral lesions or ulcers that could be open and bleeding? Yeah. You see how I just figured out that that client was high risk of transferring communicable diseases to me because I knew some things? That's what you guys are building right now. You're building this to be able to think, okay, what's the PSW thinking? What am I thinking as the PSW? I'm thinking this person might have a history of bad oral care, so they might have lesions. I'm thinking they might have poor nutrition, healing, wound healing. They might have open sores on their skin. Right? You see how you can start to think like that, right? That pizza, or cooking delicious pizza. Can't help. Remember that the clients may not have symptoms, especially now in today's age, time and place, especially if they're having good medication management. They may be completely symptom-free. Okay, like my buddy, he is symptom-free right now. Okay, which is wonderful for him. Wonderful, I'm so happy for him. But right, it adds that layer though, as the healthcare worker, you actually, now I forget because people are looking like they're not sick. You need to remember people are sick. Did I give anybody sexually transmitted infections? No? Okay. So STIs used to be called STDs. Some of you are going, what's STI? Because I guess we changed it because some of them we can cure, I guess. So it's not that it's a disease for forever. I'm guessing. I don't know. I don't know if most clarifies. But whatever. It used to be STD. Now it's STI. All right. Sexually transmitted infection. So that's sexual contact. So that could be oral, vaginal, anal. Doesn't matter. Again, we're back at that like sexual contact piece. Okay. Lots of times people won't have won't have any symptoms. Other times they will. Some people know that they have something, but they won't go get treatment because they're embarrassed. Right? If you're embarrassed and you don't want to come and see me and to tell me, if you're a young adolescent and you're learning stuff and you think you might get in trouble with mom and dad, so you don't tell them because you don't want to get in trouble. See how things could go undiagnosed. And then finally they go to university and then they can go to the doctor by themselves. And if you gave anybody STDs, oh my gosh. I don't want to know if you gave people STDs. Don't tell me. I don't want to know. I don't want to know. It's funny. But it's embarrassing. It's embarrassing for people. And we have a lot of unconscious bias with regard to STDs and stuff like that, right? So it's really important that we have these, we talk about it openly and professionally with our clients so that they tell us. And we encourage people to get tested so that we can treat, and then we keep other people safe. Okay. Like I said, yeah, that they might be embarrassed, especially if we hear something like genital warts. Oh, I'm not gonna go and like get. I don't want to go to the doctor for that. I don't want, right? Just create this. But yeah, stigma based. That unconscious bias is stigma based. Okay, so you may have them in the peri area, the mouth, throat, right? These type of areas would also, right? You could get them in other places, like the eye, or having HIV or coronavirus. Which do you prefer? That's a loaded question. I can't answer that question, Sir Davidson. Why do you even ask that question? It's a bad question. Come on now. Terrible question. I don't want either of them. Neither. No, that's the answer. Anyways, could be elsewhere though, right? I don't know, nipples, whatever, right? But eyes, right? Mucous membranes, so transferable. But nose, right? If it's in here, this whole cavity is all connected, right? So, yeah, exactly. I love it, Tracy. None of the above, Davidson. Yeah, you're done. Davidson's, you're done. that quiz is closed. Where did they? I don't know. Like, did you get syphilis through your eye? And you look like you get syphilis when you get to stage 3. I don't know. What do the eyes look like? What are you talking about? What do the eyes look like? It's mucous membranes. So you can get sick through your eyeballs, right? Or maybe I'm not answering the right thing. Yeah,
okay,
Charles.
okay, Allison, because
Oh, yeah.
I thought it was saying that your eye actually shows an infection from it.
No. Like STIs can occur. You can have a
Through the
sexual
membranes,
infection in your eye, right? You can also get fecal matter in your eye, and that would not sexually transmitted infection, but fecal transmitted
transmission based.
But yeah, just like this spot, like how can you catch it and why you might catch it? If sexual fluids were now on your face and in your mucous membranes, you could contract the stuff that's in those fluids. Fair?
No, I'm fully aware of that. I thought it was actually saying that there was a type of a sore that shows.
Well, I don't know what could grow. I suppose it depends on what you're contracting. I don't know what's.
Forget it.
I don't know what'll grow. I don't know. Can you get herpes in your eye on your eyelid? Let's find out.
Hard? Too hard.
Eyelid. That's what you're asking me, right? Answer is yes. There you go. So your cold sore that you can move around, right? Herpes virus, you can move it around. You can get it on your eyelid. There you go. So, but the eye membrane is what I was meaning. That's a mucous membrane open to accept bugs and germs and the like. Always open for business. Those eyeballs. They're always willing to take bugs. Yes, Nasran.
So for transmitted infection, can you get it through the water if you swim with somebody that has?
No. It's sexually transmitted. It's transmitted through sexual contact.
Direct.
That's why it's through sexual contact. So Mosby's asks you about swimming. No, like Mosby's is saying STI, sexual transmission. That's your answer. Okay, but it can be to different areas. Yeah, so it's like from those secretions. So they can be moved around the body, but it's sexual, those sexual secretions. Okay. Yeah, Veronica.
Thank you. In the last paragraph from the sexual transmissions, it says some STI can be spread through a break in the skin, contact with infected body fluids, blood, semen, saliva. So that means if, let's say, the client or a friend or whatever has that problem and I have some open area in my skin, I don't know. I'm kind of confused with the sentence.
it means that it's like hepatitis came from blood, like to the, like, okay,
Sorry.
sexually transmitted disease is being transmitted sexually. Blood to blood, mucus to mucus is blood to blood, mucus to mucus. If the disease is in your blood, then it's in your blood. Was it transmitted sexually or not?
That I don't know. I understand it's just sexually, right? But it threw me out that sentence. Sorry, I just cannot.
It means that not. It means that not only can you give it to me when we have sex, but if I share a needle with you, I can get it too.
Yeah. And what about the saliva?
No, not with the saliva.
Or semen or saliva. Blood, they're all examples of.
Don't worry about that. I will check with you later.
Well, no, I imagine that more people are confused too. So
Maybe not. Maybe it's just me.
like herpes, I guess, can be through a cut in the skin.
Adriana, please answer.
HIV, like HIV, I can give it to you. I can give you HIV through sex, or I can give it to you through blood transfusion. We didn't have sex if you give it. And Adriana knows the saliva is controversial because it is. That's why I mentioned, right? If I bite my cheek and there's blood in my saliva, now you don't know that there's blood in my saliva, but it's contaminated with my blood. So that's why I was talking about this, like Nastran's example of the homeless population. And I know that this population has bad oral care. So they're high likely to have sores inside their mouth, which means they're high likely to have blood droplets in their saliva, which means they're highly likely to transmit that HIV blood droplets in their saliva when they cough on me. HIV is not transmitted through coughing, but if the blood droplets from their mouth go in my eye membrane, then I can connect to HIV. This is right. It's literally. That. Does that answer the question that you're having? Did that example? That there you go. So I can give it to you. We have sex. I give you HIV. Or maybe there's blood particles in my spit, and I go like this, and it hits you in eyeball. You're contaminated now. That's why you wear PPE when you're told to wear PPE. If the stuff can be transmitted, and we say put the goggles on, you put your darn goggles on. That's why. And the mask is protecting even more than the goggle, the shield, right? So we even have levels within. Yeah. So it's better to go back to the AIDS one. Sorry. Thank you, Adriana, for helping too. Does that good, good. HIV, yeah, breast milk, yeah, including breast milk. HIV includes breast milk. Okay, but do they talk about in this? Yeah, they do. It's on page 880. They say breast milk at the bottom, second from the bottom. HIV spread from infected person to another through exchange of certain body fluids like blood, semen, vaginal secretions, or breast milk. Okay. What about, are they on the inside of the mother? What? Like the mom, the pregnant mom will know is HIV positive. Okay. What I got here? Caring for kids. Come on. Here we go. For those of you who want a little bit more, here's a link for Ontario's prenatal HIV testing program, which has no relevance though to Mosby and our PSW program, but there's a link to our Ontario bit, okay, for extra. If you're working with marginalized populations, though, it may be something that you're interested in. If you travel and you plan on, maybe you have friends or family and you want information, so there's just a little bit of extra information there, though, for anyone interested on that point. Okay, so anyways, for STIs, we really want people to use condoms. So we're the healthcare lens, the glasses that we are wearing, people make their own choices, but we want them to make the best bad choices that they can make, right? Or the healthiest bad choices, or, it's always like that. So no problem. You want to engage in sexual activity, cool. We really want you to use a condom for these reasons, to reduce the risk of transferring or to reduce the risk of catching something. Your swimming pool's very safe. It's got crap tons of chlorine chemicals that kill stuff, literally, as well. The diseases are not living in the chlorine, and also which diseases are being peed, okay? But you nailed it. Remember when we were talking about hepatitis, and I said one of the common things about catching hep is contaminated ice cubes, right? Because the water, okay? But your swimming pool has so much chlorine in it, like it kills everything. That's why you can't even open your eyes in the swimming pool, because there's so much chlorine to kill everything that's in it. So they're doing, they do science to figure out the thresholds to kill stuff in pools, and then that becomes the best practice. That's why all the pools have a minimum amount of chlorine they got to put in, right? Because public health studied how much chlorine needs to be in pools to keep people safe. So we put that much chlorine where Bob's your uncle, you're good. Feel good. For the most part, right? That's a big safety umbrella. But okay, so our clients, though, that are sexually active, we want to encourage them to do safe sex practices. We actually really want to educate our youth in safe sex practices. This is one of the reasons why I had mentioned to you guys out of Mosby's, why we're seeing such high rates in elderly populations with STDs, or STIs, sorry, and youth. We're seeing kids with oral, throat and mouth occurrences, because they think they're being all safe. Haha, I'm not having sex, so I can do everything else, not realizing that they're still transmitting disease. But they're not going to get pregnant because they're not having sex to get pregnant. But they're doing everything else possible, and they're not using protection because they can't get pregnant. So the education has been, don't get pregnant, don't get pregnant. The education needs to be, don't spread infection. You can do whatever you want, but you got to use a condom. That's where that needs to, right? So now we've got the kids that are not having sex to get pregnant, but they're not being safe either. Okay? So, Davidson, if you can, to live long, avoid kissing, avoid sex. Just don't get married. You just just have sex with one person, and if they don't have sex with anybody else, then you won't get anything, because you won't get any sexually transmitted diseases. There's an argument, but that's not saying that you have to be, one partner, right? Who am I to tell you what you love and what you want? Go have 100 sex partners. I don't care. Just please wear a condom. That's all I want. Right? Use a dental dam. Use real protection. Use a barrier protection. That's all I care about. Right? So, yeah. So a lot of it too, like we talked about, we created this safe environment here. Your clients need to feel safe to talk to you about these issues. So if your client is embarrassed that they're HIV positive and they're still having sex, and they're not using a condom, are they going to tell you? They need to feel safe enough to say, hey, I don't have access to condoms. So you can say, we need to get you access to condoms. We need to find condoms for you, right? And do that education to keep people safe. Okay. I guess the last thing on my little list was immune system disorders. But please do review the table. You've got a STI table on page 882. And that has four common ones, right? Some of the signs and symptoms, and then some of the treatments, okay? When we look at syphilis, for example, we don't hear a lot of people are having syphilis now these days, in first world, in North America, for that matter, okay? And what's really interesting is people don't tend to get diagnosed with syphilis in the early stages. They tend to get their syphilis diagnosis end late stage because their symptoms finally are out and about saying hello, and you start to get us on this testing. And so people in olden times, I suppose, and historically, would spread syphilis everywhere because they didn't know they were sick. Because we didn't know we were sick until like stage 3 syphilis. So they were going around giving it to everybody. Many people, famous people back in the early 1900s, like when I mean historically, like not that far ago, but like far enough, right? So, but like in the 1900s, early 1900s, like we were seeing like people really like dying of syphilis, like rampantly. Who is it? It's what's his face? Then he had syphilis, right? He was crazy. He lost his mind at the end of his, but apparently it was related to the syphilis and the symptoms of his untreated and undiagnosed syphilis. I don't know. That's old stuff, but that's the story. That's, or at least the social media story that goes along with Van Gogh, is that was syphilis. Anyway.
What's the name? Van Gogh?
Van Gogh.
Oh,
Van Gogh. The guy, he's a painter.
Okay.
They diagnosed him, he had gonorrhea, lots of sexually transmitted diseases back then, though, because nobody worked with it. We didn't have condoms anyways. He's like famous for stuff like Starry Night is one that he's famous for. Anyways, old painter, just a little bit of a link because we don't really hear about syphilis these days. Okay. Last thing, so autoimmune disorders. As I mentioned, my segue into Adriana and teens hepatitis was I was mentioning a friend has an autoimmune disorder and it attacks her liver actually. So she has cirrhosis of the liver, and the girl never has drank in her life because she was diagnosed as a young child with autoimmune and liver involvement. So she doesn't drink, but she has cirrhosis. She has that scar tissue, right? It does not work well. Okay, so autoimmune disorders, the body's kind of attacking itself. The immune system doesn't like what's going on inside. So some people will have like skin stuff going on, or GI stuff, right? It can affect us in different places, in different ways, okay? Some more common ones may include rheumatoid arthritis, rheumatoid, that damage that's getting done in there is often called an autoimmune rheumatoid
rheumatoid fits under autoimmune. The celiac disease, those kind of things, they'll often fit under the autoimmune piece as well. But Hashimoto, Graves, and lupus, these are three that we see a lot of in our population here. I know multiple people, literally, I personally know multiple people with Hashimoto's diagnosis. I know multiple people with Graves' diagnosis, and I know multiple people with lupus diagnosis. Okay? So it's common enough. Something's not right. Our immune system's not going good. Our body's not happy. So something's going on internally. Okay? The people who have autoimmune disorders outside of this little Mosby's often take a long time to get diagnosed. Anecdotally, my friends that end up with these diagnoses, usually it takes a while to get to these diagnoses. Ooh, Siobhan. Look at her using the nice language. Siobhan, can you tell us what is chronic urticaria for those in the class that don't remember what it means yet?
Yep, hives. Chronic hives all over my body, head to toe. Swollen faces, stuck lip. And nobody knows what triggers it. Like my doctors, I have so many blood tests. It's ridiculous.
So it makes sense there when I said there's people with autoimmune stuff. They often are suffering for a long time before they get a diagnosis because they're just trying to figure out what the heck is going on.
They try to rule out everything. First they thought it was lupus, but it wasn't.
Would have been nice if they caught it right on the first go too.
Right. But you never know. When it hit, it hit.
Mm-hmm. Yep. It's not easy for people. And I'm going to use Siobhan's example of her hives, this chronic hives. Imagine, right, thinking about determinants of health, thinking about comorbidities, right, diseases and mental health and all of that kind of stuff, and infection control. If the person's itchy, what are they at high risk for? Skin damage. And what do I know about skin damage? Am I going to open myself up to infections? Do I have dirty fingernails to add bacteria into open wounds? I saw Veronica just go like this on her desk. I'm hoping that's because you just, like, your brain just made one of those circles like, oh my gosh. Yeah, right? It's so connected. It's interconnected. The body is so cool, right? Allie, it's not cool anymore. We get sick. No, it's really cool. It's really interesting. I don't mean it from an insensitive perspective. It's just really incredible how I can see these things, linked together and work together, work against each other, elevate the risk, reducing the risk. It's just really interesting to me. So please do review the autoimmune conditions, and then we're into key points. It's 2:27, so a little bit longer than I was planning, but I nailed all the topics and we had good discussion today. So I'll happily give you guys independent project time to work on your oxygen readings, to work on just randomly getting caught up with the readings or wherever you need to be. I scratched myself way too hard and my arm hurts now. That was bad. I didn't even need to scratch my own arm to do that demonstration, but I did because I'm a dingaling. Thank you. Welcome to my life. Okay, so we've got, I'm not going to add, can't remember if that's the last, oh no, let me use the other page, that's better. I'm just gonna copy and paste. For those of you that don't look forward to my copy pasting the readings, see you tomorrow morning at 9. This is independent study until 3:30. I'll double check, Myrna. I will double check. For us, we're going into, we're going into day 4. So you guys already,
you guys already read chapter 40? Was that on yesterday's? No, I can't remember. Chapter 40 wasn't on it in the readings? Well, whatever. I'll give you all whatever this is, folks. There's more than needs to be on this one, but let's do this. Oh, don't worry, I'm gonna edit that. I'm editing right now. Don't worry, I'm editing. I didn't want to hit the enter button. There we go. Give me a second.
All these results for test tomorrow?
There's no test tomorrow.
Wow. Really?
I think someone needs to check their syllabus. Someone needs to check.
But that guy you gave us, that drawing, that's a timetable you made. It says test tomorrow, right?
No.
Does not say test tomorrow.
Look it up.
Tuesday test. Tuesday the 7th is next week, not tomorrow. I'm still editing that thing. Don't panic yet. Still editing that stupid long message. Don't hate me. It's shift enter. Not if you just hit enter, then it sends the message, and I guess my shift button didn't stay down. Oh. Oh my goodness. There's way too much stuff in here. Why won't it be big? Okay. There we go. That. Fixing it now. Here you go. Here you go. Here you go. Yeah, shift, enter. Enter. There. Now it's legible. Copy paste all the stupid bullet marks from my sheet. That's like everything for today and tomorrow's stuff, because I don't know where we were with it. So if you're in the syllabus, it doesn't matter. You can choose to ignore my message, though. That's the extra stuff. You can start obviously working ahead into eye and ear. I told you, David. Told you so. Shine your eyes. Increase BP with test mark. Yeah, we shouldn't have told him. We should have scared him. Davidson, we shouldn't have told you. He would have been studying all night. Would have been a mean trick. Yeah, Nastran?
I'm scared to confuse you, but my question is the sexual.
You paused, or I'm paused.
Oh,
Y'all are frozen for me. Just give me a second.
okay.
Hi!
You're back.
I missed everything you said, Master.
I just said it. I was waiting for it. So we know they are HIVs. They are they are virus. But sexual transmitted infection, the infection is bacteria, right?
Could be viral, could be, it's an infection. It's infection.
Okay.
It's infection. Sexually transmitted infection. It's infection. Okay? Yeah, could be a variety of things, could be whatever, but it's infection. Go with that. Okay?
Thank you.
I denied myself a good weekend reading through all the weekend. I'm like, no, Davison, maybe you're guaranteeing yourself 100% on your test next week because you've already done half the reading. Right? And your, the oxygen needs information should already be in your head. Well, you'll be on point. I'll be quizzing you on the upcoming topics, Davidson. Anyways, guys, no, please do take advantage of the last hour. Go for it. Get some studying done. Work on that oxygen assignment. Get a couple of questions done. do that reading. Absolutely. Ciao. I'm here. I'm in another meeting. So if you need me, just private message me, but I'm technically here. So it'll just take me a minute to respond to you and we're good to go. Okay. Let Davidson write the test today. Yeah. No, not happening. Someone else tell Davidson why I made that timetable. Because of the confusion, Davidson, because of the confusion. Next week, we have 2 more modules. We have abuse and medication management. So it's a really, really, really busy week. So I was just trying to prepare everybody in advance. Okay? Bye-bye. Thanks, everyone.
the sunshine in my life will never be the same again. Everything just seems so right now that I have you on my mind. You are so okay, so and even in a better world, now that I'm with you, this love is real. I see it in your eyes. You take my hand and I understand. You are mine. You are mine. All right.
Oh.
ma-vaccine ako ng Jay. Let's eat. Let's eat lunch. Wala na naman mamayang gabi. Kaon dong. Dapat pasta niya. Oh yeah. With my son. Where did that song come from? Who? Ay, ay, ay. Definitely. Summer breeze makes me feel fine. I need to sleep. I have to say bye bye to everyone. Thank you so much, guys, for watching. Thank you for staying with me. Kahit na wala naman akong ginagawa, nakikinig sa teacher, nag-i-edit, gumagawa ng homework, but still, I have to say thank you to all of you who supported me, Kaganda 21. I have Jored's TV, Triple J Mix Vlog, Partical, Million Ways, Grits Figueroa. Thank you so much for staying with me till 3 live. Thank you so much, guys, for staying. God bless everyone. Bye bye. And see you again tomorrow on my next lesson is hearing and vision disorders, health conditions of those people. Okay. Thank you so much for watching. Bye bye, everyone. God bless.